It's my great pleasure to introduce Dr. Suzanne Stevens. She is a neurology specialist trained at Rush University in Chicago and spent 15 years at the University of Kansas. She's recently started working at the Kansas City Hospital and VA, and she's a specialist interested in treating hypersomnias with individualized and creative ways to improve their lives. Thank you so much for joining us today, Dr. Suzanne Stevens.
All right. It's great to be here. This is a wonderful conference. So let's see, how do I advance here? Okay, so I'm going to kind of go through the thought process that I go through when I'm trying to find a treatment plan for an individual. It's not a one-time thing. You know, if it were easy, everyone would feel better quickly. It's a constant reassessment of the needs and of the symptoms. So part of what goes into the thought process is what are the symptoms that are bothering the individual, age, if there's, cardiac issues or some sort of health issue that might make you want to be a little more cautious with the medications. So for IH, the sleep inertia can be very impairing. And I can't tell you how many times I've heard people tell me that they've lost numerous jobs because they wouldn't be able to wake up on time for their jobs. And they don't volunteer that. You have to kind of, ask if you're going to get that answer because they don't know any different, and it's very, very impairing. And of course, it can cause trouble with family dynamics. If the example the other day was a veteran at the VA who maybe is 40 years old and big burly, Army guy. And he said, I've got to use 10 to 15 alarms to wake up in the morning, and it really makes my wife mad. So there's lots of family dynamics that can be uncomfortable due to these situations. And of course, the unrefreshing sleep and the daytime fog. I generally just ask, which of these is the worst, kind of prioritize what you'd like to start with. And then, of course, with narcolepsy, the symptoms, the daytime sleepiness, automatic behavior, the zoning out where you might drive to some place and get there safely but not remember the details of the drive. That's automatic behavior. And of course, sleep paralysis, the hallucinations, cataplexy, fragmented nighttime sleep, and I can't forget nightmares after our talk right before this, but we just go through this list of symptoms and see what needs improvement. So I'm going to start talking about Oxybate first, for no particular reason. But Oxybate, I'm going to also tell you the brand names of these because sometimes people know it by one name and not the other. But so there's Xyrem and Xywave and Lumryz, basically are the three. The sodium oxybate, the number one, is the one that people typically take twice a night. And it's got a lot of sodium, 1,600 milligrams of sodium in a full dose. So that was the original that came out last century when I was a fellow. Well, that's when that came out. And that is a twice a night. So that's Xyrem. The second one is Lumryz, the extended release sodium oxybate, where you don't have to redose it in the middle of the night. And then the third form is low sodium oxybate, which is Xywave. And that one's twice a night dosing as well. And just as a caveat, because I don't want to forget to say this, you're not supposed to eat 2 hours before you take the dose. Otherwise, you don't get the full effect. And interestingly, the new GLP medications, the injections for weight loss, can slow down digestion. So sometimes it has to be 3 hours that you can't eat before you take it to get full effect. So the unrefreshing sleep and sleep inertia is what Oxybate can really, really improve. I've seen it change so many lives. It's not for everyone by any means, but it can be very, very, very helpful. I joke that the day it was approved in 2021 was one of the best days of my life because that was the first day that we had something approved for idiopathic hypersomnolence, because before that there was no FDA approved medications. So because of the nature of the medication, There's one single pharmacy in the whole United States that distributes it. The chemical it is GHB, which can be abused on the street as one of the date rape drugs, which sounds super scary. It can be diverted, and if it gets in the wrong hands, it can be misused. But because of that, the government wants it to be accounted for, every single bit of it, so it doesn't get diverted. So there's one single pharmacy that delivers this, and it comes to you. Someone has to be there to sign for it, or if you're not home, you can, they've got these lock boxes, you can go and pick it up at times. And then just so you hear this, in case you haven't, there's a REMS program, which just is a way to keep track of the medication. The doctor has to be part of the REMS program to prescribe this. The individual getting the Oxybate signs a form as part of the REMS program, and it's just an acknowledgement of the controlled nature of this medication. So it is approved for IH, and it is really, really good for improving sleep inertia in people. It also helps the function a little bit during the day, but it's typically not enough by itself. Typically, if people are on this at nighttime, they still need something during the day to feel good, a wake-promoting agent or stimulant during the day. So this is one that is taken, okay, this is how I explain it to my patients. This is exactly how I do it. So if you were, as someone with IH, if you were to take a sleep aid, whether it's something prescription, Ambien or something like that, even like over-the-counter Benadryl or something, it might help you fall asleep quicker, maybe wake up less. But with IH, you don't feel rested in the morning, even if you take something to help you sleep at night. So the sedation is one property of the Oxybate, but there's a second unique property that no other medication has, that when you go to sleep and you take it, it kicks in right away. You get this really, really deep stage 3 sleep. On the sleep studies that I read for people that are on Oxybate, that they bring the Oxybate with them, it's the most amazing thing just to see how deep and just amazing the sleep is. But that's one property to the Oxybate. While the Oxybate is in your body, the brain is storing up all the waking neurotransmitters in the neurons. And when the Oxybate leaves your body in the morning, your brain releases this rush of these wake-promoting medications, wake-promoting neurotransmitters, and it's like you have a medication already in your body and you wake up feeling rested. So that is what is so unique about this medication, and can make such a difference in so many lives. So GHB, it is the chemical GHB, and that can be super scary when you first hear about that. And I've heard horror stories of physicians. That's the first thing they say to people. Well, we do have this medication, but it's a date rape drug. And then the first thing is like, oh my gosh, no. But once you frame it into, it's a chemical and it's pharmaceutically controlled and it will help you, and we just don't want it diverted. It kind of puts it more into perspective. Potential side effects are headache, dizziness, and nausea. This is what it looks like when it's delivered. So it comes in a bottle, and it's like, it kind of looks like a cough syrup bottle or something like that. And it is a liquid medication, which is unusual in and of itself. But you get these two medicine, where it says pharmacy containers, you get these two medication bottles, and you prepare the doses at the beginning of the night. You pull up in the syringe, because it's liquid, the amount that you're supposed to take. You mix it with some water, and you prepare both doses at the same time. So in the middle of the night, you're not fumbling around trying to get the second dose prepared. So you prepare both doses. And this, again, is very unique to this medication. For IH, there's two different ways people can take it. One is the traditional twice a night, where you take it at the beginning of the night, and then 2.5 to 4 hours later, you can take a second dose. People with IH that sleep really, really deep to begin with often will just take a single dose at the beginning of the night, because it's actually, to them, disruptive to have to set an alarm that they typically sleep through, and they don't get the second dose. So there's two different ways to take it. So that's oxybate, that's Xywav. Now, sodium oxybate, this was released, it was the first oxybate released. Again, it has 1,600 milligrams of sodium in the full dose. So if you've got high blood pressure or, kidney disease where you're not supposed to have extra sodium, this will not be a good medication for you. It is approved for narcolepsy, but we use it in IH as well. And people that have POTS that benefit from high sodium might be a good population to use sodium oxybate instead of oxybate. So one thing to remember about oxybate is that it's sedating and it can cause snoring and sleep apnea. So even if you didn't snore before, it's kind of like similar to if you think about if you have some alcoholic drinks in a night, you're more likely to snore because it's a muscle relaxer. It's the same concept with this. So we always ask about if you're snoring or stopping breathing, and then do a sleep study to see if there's sleep apnea. And because these medications, every medication I'm talking about today uses the same neurotransmitters that mediate mood. So we have to watch mood very closely with this medication and make sure that anxiety doesn't get worse, depression doesn't get worse, and so forth. And again, often you still need a daytime medication, even if you take the oxybate at nighttime. And this is just a picture of the Xyrem. Xywav was the previous picture. The same concept of the bottle, the syringe, the 2 medicine bottles. And the titration is listed here. You start at the low dose for a week, go to the 2nd dose, 3rd dose, 4th dose. And if at any point you feel crummy or you get nausea or something, you can always go back down to the dose before that. So if you were to start at the 9 grams per night, like with no titrating up, you'd be really nauseated. Lumryz is the newest oxybate preparation. This is the extended release that is just once a night. And it's not a liquid, but you make it into a suspension. So there's 4 different dose packs, and you mix it with water, and it becomes this kind of suspension, kind of thick sort of mixture. And you take it at the beginning of the night and sleep throughout the night. The advantage to this is that you don't have to dose in the middle of the night. The disadvantage in my mind, which is only true for some people, is that you can't tailor the dose. Like if you use the syringe and use the liquid, you can kind of go to in between doses. If 3.5 is too much and 3 is not enough, you can do 3.25, but there's these fixed doses for this. And the other advantage for some people for the short-acting oxybate is if on certain nights you don't have 8 hours to sleep. So for example, this is a frequent scenario that someone is in, retail, and they close the store, close it up one night, and then they're supposed to be there at, whatever time, 7 a.m. the next day, and they don't have a full 8 hours to sleep. They can just take 1 dose, whereas you couldn't take the long acting because there's not enough time in bed. Okay, that's oxybate. And now I want to go to the daytime medications, which are the more commonly used medications. And I'm a neurologist, so I had to put a picture of the brain in here. But what I wanted to point out is the green where it says orexin neurons, that's kind of like the orchestral conductor of the whole process. And then that communicates with all these other little centers in the brain they're each individual centers, like one releases histamine, one releases dopamine, and so forth, but they're all in communication with each other. But if it were easy and just to say, well, you need more dopamine, you need more histamine, but it's not that easy because people respond to one medication and not the other. But what I wanted to kind of, have you conceptualize is in the brainstem and the inner parts of the brain, the hypothalamus and so forth, is where all of this stuff is going on. And that's what sends the message up to the cortex, the outer part of the brain, to be awake. There's a lot going on here. Just another brain picture, same concept of orexin communicates with all the different centers in the brain that mediate sleep and wakefulness. Got one more. Okay, here we go. So this is where we get into kind of the creative part of treating daytime sleepiness. There are stimulants in one category, which I will talk about. Then there are wake promoting agents, which are in a second category. And that's kind of how I separate them in my mind. So the stimulants, when you take the stimulant, it goes almost everywhere in the brain, including the frontal lobes. And that's why it helps with ADD and ADHD and so forth, and helps focus. And of course, it makes you feel more alert. So we often will use this for someone that has a coexisting diagnosis of ADHD. The other reason this is the first choice sometimes, which is a few slides down the road here, but a couple of the wake promoting agents interfere with birth control. So if you're on birth control and you don't want to have a surprise baby and you don't want to use a backup method, then stimulants are safe in that regard because they don't interact with hormonal birth control. Okay, and I always want this to be something everyone remembers after I speak. The highlighted ones interact with birth control. So always be aware of that. The modafinil, armodafinil, and pitolisant, which are Provigil, Nuvigil, and Wakix. Very, very important to be aware of that. The Sunosi, which is solriamfetol, is cleared through the kidney. So that does not interact with birth control. So in a situation where you're on birth control and you need to be on it, either Sunosi or stimulants are the best bet. So modafinil, which is Provigil, Dr. Tridy talked about this earlier, but it does have a strong recommendation for use in IH, and it is FDA approved for narcolepsy. You have to take it twice a day typically, and that's a big mistake I see with people that come to me and they are undertreated, is that they're prescribed one dose in the morning. So by noon or 1 o'clock, they have nothing in their system for the rest of the day. You have to redose it the second part of the day because it's an 8-hour med. So side effects can be headache, dry mouth, fast heart rate. Again, it does interact with birth control, so please be aware of that. If you have an IUD, that's a safe form of birth control because it's kind of like a physical barrier. It's not hormonal based. Okay, I had to put a picture of a neuron also, but this tells the mechanism of modafinil. On the left side where it says DA neuron, that means dopamine neuron. And then if you see like the trail down to the part where it says DA dopamine, that's the end of the neuron that releases the dopamine. Modafinil allows more dopamine to be in the synapse and to communicate with the rest of the brain to make you feel more alert. And that's thought to be the mechanism. But because of all those interactions in that brain picture I showed you, this also, thought that it increases histamine and has some other actions as well. I call this a sister drug to modafinil. It's called armodafinil. The advantage to this is it's once daily as opposed to having to redose. It's a little more potent. So like 250 milligrams of armodafinil is equal to 400 milligrams of modafinil in divided doses. So sometimes people are like, why are you lowering my dose to 250 milligrams? It's just a more potent, different chemical. So just remember that it's once a day. It does interact with birth control, and the same sort of set of side effects, headache, dry mouth, fast heart rate, anxiety can be present. Solriamfetol, which is Sunosi, that's the one that's cleared through the kidney. It works through dopamine and norepinephrine. It's cleared through the kidney, so it does not interact with a lot of medications. It is a once-a-day dosing, which is awesome, and it is FDA approved for narcolepsy. But if I've had situations with IH that stimulants were not tolerated, they're on birth control or some hormonal thing, I can sometimes get Sunosi approved by insurance based on that you can't use, Wakix, modafinil, or armodafinil, and maybe stimulants are not tolerated. So Sunosi is the most logical treatment. Pitolisant, which is Wakix, works through histamine. It interacts with birth control. Please be aware of that. And the interesting thing about this medication, it is not a controlled substance. So the stimulants are controlled substances, armodafinil, modafinil, Sunosi, this is not a controlled substance. So it's easier to prescribe in the sense that you can, refill it for a year. Whereas, of course, the stimulants, you have to write, you can only write 90 days at a time. And it's strange, but it comes from specialty pharmacies, not because it's weird like Oxybate, but that's just how the company chose to do it. So it gets mailed to you. Okay, so onto the stimulants. Methylphenidate, which is known as Ritalin, is one of the most diverse medications that there's so many different ways that you can get it in your body. There's a 4-hour immediate release. There's an 8-hour LA long acting that has a combination of immediate release and long acting. There's a 12-hour controlled release that the brand name for that one's Concerta, if that sounds familiar. There's a skin patch that you can put on so the medication is absorbed through the skin. So if there's digestive issues, again, with the GLP medications that slow down the digestive tract, I've had people where their medicines aren't absorbed as well because the digestive tract isn't absorbing them. So we can use a patch and bypass the digestive tract. There's chewable, there's liquid, and then delayed release, which is the brand name is Journey. And you take it at nighttime. It's got an inactive outer shell. 9 hours later, when it hits your large intestine, which hopefully is in the morning, it starts releasing the medication. And so you wake up with medication in your system, and it's easier to wake up to the alarm and start your day. So it doesn't have any impact on the sleep. It's just delayed release methylphenidate. So I love this about this medication because there's so many ways to use it. And say, for example, you're on the 12-hour controlled release, but at 1 o'clock every day, you kind of get a slump. You can supplement it with a short acting at noon. Or if the most important thing, I think, is that every day is not the same. So some days you're more sleepy than others. Some days you might feel a little more alert. So on the more sleepy days, you should have something as a backup. So if you have to drive and you're sleepy, or you need to go to your kid's game at night, or want to go on a date night, that you've got a short acting that'll get you through those activities, in addition to something that you take every day. Mixed amphetamine salts, this is Adderall. There's 4-hour, which is immediate release, 8-hour, which is XR, and then there's a wonderful mixture called Mydayis, which has gone generic, I believe, that has a different proportion of the amphetamines in it. So Adderall has 75% of one of the amphetamines, 25% of the other. The one that's 75% is the one that's more likely to cause side effects like anxiety, fast heart rate, headaches. The Mydayis has 50-50, so it's got less of the one that causes side effects and more of the one that doesn't cause side effects. So if on Adderall people get like fast heart rate or anxiety or headaches, and you switch them to Mydayis, a lot of times it's much better tolerated. And then there's also a skin patch. It's called Zelstra. So again, you can bypass the gastrointestinal tract if necessary. In the stimulant category also, there's lisdexamfetamine, that's Vyvanse. It's got a little bit of flexibility in it, that it's got a capsule and also a chewable. So if a chewable, again, if digestion issues are present, a chewable might be a little bit better. And then there's dextroamphetamine. The brand name is Dexedrine. It's got a short acting and a long acting. And then dexmethylphenidate is a kind of souped up methylphenidate that's a little more potent than Ritalin, and the brand name of that is Focalin. And that comes in 4- and 8-hour formulations. It's okay to have more than one medication to treat hypersomnia. And I think that is a very underutilized technique to help alertness during the day. At the VA where I just started, a couple of people I've seen have been on, Dexedrine, an appropriate medication, but the same dose for years and years and years and years. and they're having all these fluctuations of when the medicine wears off, they're getting a dip, and then they take the second pill and it takes a while for it to kick in and things like that. That's why it's constant reassessment of the symptoms and what can we do better. And as a reminder, if you take Oxybate at night, you still will need daytime medications. This is actually the, Dr. Trotty went over this morning. This was the recommendations by the American Academy of Sleep Medicine for idiopathic hypersomnia. And just kind of the highlight is that modafinil has the most data. But again, this was before Xywav was FDA approved. And it does have, conditional recommendations for some of the, like Wakix, Ritalin, and so forth. Clarithromycin is an antibiotic. It used to be, well, the brand name in the past was Biaxin. And when people took this for whatever infection they had insomnia and they felt more alert during the daytime. So it turns out that it helps, like we talked about earlier today, the ramping up of the GABA receptors in IH. And this helps kind of block those extra receptors and can increase alertness. Being on an antibiotic long-term obviously can have its own downsides, with yeast infections and things like that. So it's something to be cautious about, but it does work for some people. Flumazenil is a medication that's used in the emergency room if someone has a benzodiazepine overdose, because benzodiazepines are GABA medicines, so they've got too much GABA, and this reverses that. So, and if that subpopulation of IH that has the ramped up GABA receptors, if you can block it with flumazenil, some people feel more alert. It's not FDA approved for this, and you have to get it through a special compounding pharmacy in Atlanta, and it comes either in a lozenge or a cream that you put on your arm. I have used this in a few people with IH. They did not feel any better, so they probably don't have that variant where the GABA receptors are upregulated. Another important thing with treating hypersomnia is just making sure there's not another health issue that's contributing to the sleepiness. At the academic center I was at, multiple times a year, I would get referrals of young females who were seeing hematology for low ferritin, and they'd get iron infusions throughout the year, and that was thought to be the cause of their fatigue. It turns out they need, 19 alarms to wake up in the morning. They have symptoms of IH, but if you have iron deficiency in addition to a hypersomnia, it just makes everything worse. So you want to make sure you're not anemic. Vitamin D deficiency can contribute to fatigue and tiredness. If you have a tendency to have a fast heart rate, we want to be careful that the medications you give don't make it even worse. So often what I'll do is have people see a cardiologist just for a baseline, make sure there's no arrhythmia to be concerned about. And then if you need medication to function that increases your heart rate, the cardiologists recommend giving a low dose of like metoprolol, which is a beta blocker, which controls that high heart rate. Make sure your thyroid is okay. Of course, depression, anxiety can contribute to alertness issues. Premenstrual dysphoric disorder, PMS, can cause sleepiness. And, the week or two before menstruation, that might be a time that you might need a little bit more medication because you're not feeling quite as alert. And then restless leg syndrome is fairly common, and that's that uncomfortable feeling when you're in bed trying to go to sleep that can keep you from getting to sleep. That means if you can't get to sleep, you're getting less sleep at night even, so that's something to look for as well. Some people will use a light box, which is typically used for depression or circadian rhythm disorders. It does help some people with hypersomnia. And there may be coexisting circadian rhythm disorders and hypersomnia and mood disorders. So there's probably multiple reasons why that might help. And just other thoughts, some people use caffeine to assist with their alertness throughout the day. Coffee or no energy drinks, because those are really, really tough on your system, especially if you have a stimulant already in your system. But there's caffeine pills, there's coffee, there's sodas that people will use to supplement. If naps make you feel better, we try to build those into the day. That's not true for everybody though. and accommodations, which are crucial for hypersomnias, for you to hold down a job and to not have your job threatened by this. It's a security for your job. And typically we'll put things like you might be late, twice a month or whatever it might be. You might have to leave early one day if you get a flare of the sleepiness. You might miss a day here or there because, as you all know, you go and go and go for so long and then you hit a wall. And no matter how good you've been about sleep or medications and everything else, there's a wall that you'll hit where you just can't get out of bed one day and you need to sleep. So that is what the accommodations are for. And other things, if it helps, like having a standing up desk, a sit to stand desk, or sitting near a window, or being able to get up and walk around if you have to go to meetings, things like that. Last brain picture. The future does look bright. There was that talk this morning about theorexin agonists to increase alertness. And even though narcolepsy type 1 is the sleep disorder we most commonly think about with low orexin, it turns out that it might as well, supplementing might help IH and narcolepsy type 2, again, just because of that whole communication system in the brain. And that's it. Thank you very much.